Welcome to our podcast, Oncology Morning Commute, the Disparities Solution. Is there one? Morning Commute is developed in collaboration with At Point of Care and Projects of Knowledge and is part of a continuing medical education series. This independent CME-CE activity is supported by an educational grant from Astellas, Merck & Company, Pharmacyclics, an AbbVie company, and Janssen Biotech. In this episode, Dr. Otis Brawley and Dr. Christopher Flowers continue their discussion about disparities in oncology care. Is there a solution? Doctors Brawley and Flowers will look at how a team-focused solution can help patients in their cancer care journey. Information about the faculty and disclosures can be found at morningcommutepodcast.com/disparities4. You can use this link to receive your credit and evaluate this program. The URL can also be accessed in the episode notes. Dr. Brawley is a professor in the Department of Oncology at Johns Hopkins University, Baltimore, Maryland. Dr. Flowers is division head ad interim of the Division of Cancer Medicine and is professor and chair of lymphoma and myeloma at MD Anderson Cancer Center in Houston, Texas. I am Candace Hoffman, managing editor of Morning Commute. Dr. Brawley will begin our discussion.
This is Dr. Otis Brawley talking to Dr. Chris Flowers, and we're talking about health disparities. And in this podcast, we're going to talk about some of the solutions, the disparities solution. Is there one? Chris, do you think there's some solutions here?
So there really are lots of solutions to try and help to overcome some of the disparities that we've described in cancer care. There have been a broad array of support services for patients that have now emerged that help both within the healthcare setting and a lot of other support services even outside of the healthcare setting that can help patients in their cancer care journey.
Let's talk a little bit about patient navigators. Harold Freeman started the movement toward patient navigators about 30 years ago. He's also one of the people who was outspoken that the problem in disparities in health is not race, it's socioeconomics and trying to bring in other groups. And of course, now we even know that the largest disparate population for cancer in the United States is actually white Americans. But do you use patient navigators? Have you found them successful?
So we do. Patient navigators have been successful in a number of arenas. So we talked at our last podcast about cultural competence, and patient navigators are one of those resources that can really help in supporting that cultural competence, understanding what the individual needs are of the patient, helping them in terms of what your understanding of health literacy is, what their health education is, and marching them through the healthcare system, both in terms of the kinds of things they'll need to have supporting their care and the ways that they access the healthcare system. I often think of these healthcare or patient care navigators as kind of like the concierge to a hotel. They'll tell you what things are on the menu in terms of opportunities and help you to navigate and to schedule your day through your healthcare environment.
It's interesting. I usually use the big brother, big sister analogy, but you use the concierge. Now, lay healthcare workers or lay patient navigators versus nurse patient navigators, do you have a preference?
So both are quite useful. I think lay patient navigators are fantastic in that they can relate directly to the patient experience. Oftentimes, in the cancer patient environment, these are cancer survivors who have had a personal experience with cancer and been in the exact position that the patient has been in. Other times, they are allies to the cancer care environment that can help with that. Nurse navigators, on the other hand, have the professional expertise to how to provide cancer care and can help patients sometimes with some of the more technical difficulties and professional difficulties that require expertise in cancer care.
Yeah, both have one thing in common, though. They understand the system and can help guide someone through the system. That knowledge or wisdom of knowing the system, and the system can sometimes be pretty treacherous. I mean, it's a tough place to get along in, right?
You're exactly right. I mean, when we think about cancer care and think about the journey that a patient takes from diagnosis to treatment through recovery and survivorship, oftentimes these involve a multitude of components to the cancer care system. So, involving surgeons, radiation oncologists, medical oncologists, may involve physical therapy, may involve diagnostic imaging, biopsies, and other sorts of processes to the care that really require fairly careful navigation because all of those components have key timing elements to them as well. And you can imagine that someone who is completely unfamiliar to those systems of care and trying to navigate it on their own can be fraught with some serious challenges.
Just as an aside, familiarity and the ability to deal with things can be incredibly important in healthcare. I did a lot of studies 20 years ago looking at Blacks in the military or military retirees who were Black, comparing them to whites in the military or white military retirees and their families, and started making the argument that equal treatment yields equal outcome and race is not a factor in outcome. And I was talking to a social worker who coordinated some patient navigators, by the way, and she set me straight. She noted that the Black woman whose husband retired from the military, who was 65 years old now and has breast cancer, not only has insurance, but has a life's experience that helps her deal with the big hospital compared to her sister who might live in Southeast Atlanta and never had those military experiences, to the point that the wife of the military retiree who had lived in Germany or Japan or on bases and had other experiences was not as intimidated by the big hospital, was more able to find her way through the big hospital, say, to the place she needed to go, say radiology, and even better able to deal with the obstinate clerk behind the desk to get the services that she needs compared to her sister who didn't have those experiences. What we're trying to do with Navigators is try to help that sister from Southeast through that system the way her sister navigated it. You agree with that?
Yeah, that's really a fantastic example. And that's really the role that patient navigators are intended to fill, is to help navigating that second patient that you used as an example. I think of this kind of equivalent to, going to a distant city, and it's the difference between trying to pull out an old paper map and find your way to where you want to be, and now having an app on your phone that navigates you directly there. And that's really what patient navigators provide for us in the healthcare system now.
Yeah. Now, one of the problems that I have been pressed with, and I see patients, is not being able to spend as much time with the patients as I'd like. And one of the things that we're adopting now are advanced practice providers. These are physician's assistants and nurse practitioners who are taking care of a lot of our patients. And the new doctor of the 21st century is working in a team with advanced practice providers. Have you had that experience?
Yes, I've been involved with my care processes for cancer care patients for over a decade with advanced practice providers. And really, they are critical to the kind of team-based care that we need for the cancer patient. Both individuals that know the patient well and can provide care in between the times when the physician is seeing the patient, and can see the patient in concert with the physician in ways that creates that comprehensive care plan.
Yeah, my experience really is that the advanced practice provider provides an overall better quality of care by having them in the team. And they really are a team with doctors and other nurses and other staff, and they do provide a much better experience for the patient, and they are a help in overcoming some of these disparities. Now, tell me, problems in having insurance or having access to these things. Certain groups or advocacy groups can be good in helping the patient with their system, go through the medical system. Focus groups, not focus groups, but groups that meet and talk about their experiences and that sort of thing. Have you had any experience with that?
Yes, I think one of the other things that I mentioned at the outset were these external forces that can help with cancer care provision. And I think one of the things that has been a monumental step forward is the advent and growth of patient care advocacy groups. And there are a number of these that are typically very disease-focused groups. These include patient allies and cancer survivors and with a particular diagnosis, who have worked in focused ways to help patients not only navigate the system, but also navigate other components like insurance gaps, copays for medication, support for transportation to and from clinics. And having them as part of the cancer care process really can help to overcome many of the barriers that we described in the disparities previously.
Some patients have huge problems with finances. Indeed, healthcare costs is a major cause of personal bankruptcy in the United States. Social workers and some of the people who are more skilled at how you pay for healthcare can be critical. And one of the things that I've been concerned about is some of the smaller doctor groups are not able to afford the social workers in these other groups. You're of course at a huge hospital, but you see referrals from outside. Has this been a problem that you've noticed as well?
So you can see that as well, particularly in rural oncology care clinics. This is another place where patient care advocacy groups can help. But these groups typically are national groups, and any patient can access the support that they provide.
Yeah, I mean, I just prescribed everolimus yesterday, and I was told it's $19,000 a month. And this person who has insurance, the insurance is going to pay 3/4 of it.
So those can be significant challenges for individual patients that you can imagine out of pocket.
Yeah.
Some of the copays that these patient care advocacy groups are able to help with can help to close some of those gaps.
Yeah, but this is still a huge problem in disparities. I want to thank you, Chris, for a really wonderful conversation. This is Dr. Otis Brawley talking to Dr. Chris Flowers about solutions to healthcare disparities.
Great. Thanks, Otis.
Thank you for joining us today. Remember, to receive your credit and evaluate this program, please visit morningcommutepodcast.com/disparities4. For all the episodes in this series, please visit morningcommutepodcast.com/disparities.